you so much for joining us for this live Q&A about masking and children as we head back to school. It's just a couple weeks away. And we wanted to jump on because there have been some new recommendations that just came out from the American Academy of Pediatrics just yesterday about masking as kids head back to class. And their recommendation was that children age 2 and up, as they head back into school settings, remain masked. So pediatric hospitalist Dr. Sharon Stuhlman is here today to share more about the guidance. Thank you for being here.
Thank you for inviting me. And we were chatting a little before about, it was about a year ago today that we were here talking about getting ready to go back to school and how we were going to try to be more successful. And I was talking about creating learning spaces. So I, in my moments of overwhelming sort of exhaustion from this pandemic, like to reflect on where we've come, because it feels like we're doing a lot of the same thing. But then if we really look at it, we have come in some ways more positive directions. I think back to last August, I wasn't shopping in person. I wasn't eating out. I hadn't really socialized with friends. And we didn't really know how this was going to play out. So a year later, I've been in the stores. I'm still cautious, but I've been in the stores. I've eaten out a handful of times, which is nice. And I've even been on a plane, which was unexpected. So I'll start with that positive note that we've at least made some progress.
Yeah, we need that. That's really good perspective to start us off. And we want to invite people's questions, especially, of course, in light of these recommendations, also about just where we are in the pandemic as it relates to children and as it impacts them. So thank you for being here. If you have a question as we go, you can put that in the comments. We'll either get to that live or later. And also, we've been really fortunate to have a lot of people submit them already. So we'll just dive in first to recap people. So if they missed the news yesterday, can you first just kind of summarize what the American Academy of Pediatrics recommended on masking and back to school? What did they come out and say?
So the American Academy had a really thoughtful group of people come together and make a policy statement, which isn't a law, it isn't a requirement, it's just sort of safety recommendations as a group of pediatricians thinking about our kids and thinking about that we still have an age from under 11, so 12 and up are allowed, but under 11 that are still not able to be vaccinated and still at risk for the disease. And that school is an interactive space inside, and that we haven't reached in many of the states a really safe threshold of adults that are vaccinated. And so trying to take all of that information in combination with the new Delta variant and other possible Lambda variants that are on the horizon, how do we keep kids in school? So one of the things that we can say as pediatricians is that after a year where kids were out of school or virtual learning, one of our big priorities is how do we keep schools open? And so to me, this statement really is not necessarily punitive, but is really about how do we achieve that, keep kids in school, keep schools open this year, because we recognize the significant impact of last year and being home. So the recommendation was children over 2 that are going to be in a classroom setting with teachers, in order to keep the teachers safe and the students safe, that they should be wearing masks.
In your opinion, was that the right call?
It is. I think it's so hard. It's so hard. And so I have a 17-year-old at home, and we've been having these conversations about even before this policy statement came out, whether or not we were going to have him wear a mask back at school, because there's so many, first of all, because it was a really challenging year and I really want schools to be open. We did virtual and remote learning for elementary age school kids at our home, in addition to our high school. And I had never thought of burnout outside of a job before. Like I always thought of burnout in reference to an employment, but I experienced parental burnout, where I was just, it wasn't fun anymore. It was work and it was hard. And I needed a break. And so I don't want us to get to there. I don't want us to get to that threshold in the community with disease or with teacher shortages that they have to look at us being remote and virtual again. So in a lot of ways, it's trying to figure out how do we sustain ourselves for the second year, because it has been really hard. And so I just want to acknowledge that we as parents have done some really hard things. The kids have done some really hard things, but we as parents have really pushed ourselves this year to try to manage our own mortality and dealing with that in the pandemic, our parents' mortality, and then trying to make sure we're keeping our kids safe and that we're providing, nutritious lunches and activities and keeping their mental well-being. And then all of a sudden now we're educators, and it's been a hard year. So all of that together, I look at the year coming forward, and I would love that we could offer our kids 5 to 6 to 12 vaccine. We just don't have the data, the safety data yet. So I really think that speaks to how we as a scientific community are not really trying to rush that. I know there's been a lot of talk about where these vaccines rushed. And there's still a critical number and a critical time frame that you want to perform the inoculation or give the vaccine and monitor it. And we just don't have that data for our little guys yet. And so to me, that speaks that we're not rushing it. We're really demanding that we have that safety information for our kids. And without that vaccine, it's hard then to say that anything is different for them. So last year when we were preparing and we said, we need you to wear a mask because you're not vaccinated, for our kids that are going to kindergarten until middle school, that's the same for them this year.
It hasn't changed. So here's some questions. This one's from Instagram. It's a good one. With more transmissible variants, so the Delta variant you already mentioned, is a cloth mask still sufficient?
I love that question because I think about it a lot. And I think the answer is it's better than nothing. But if you could have access and it can fit in your budget, that you can buy disposable surgical masks that are kid size from Amazon or wherever, that would be great. But I don't want you to use budget that you would use for rent or for food, because a cloth mask is still better than no mask. So I do. So personally, I think it's always like good to ask, like, what do you have your kid wear? Personally, we have disposable. I've bought on Amazon disposable masks that we're wearing, and we wear disposable surgical masks, and they do have little kid size ones. So I agree with that question that we are dealing with a more transmittable variant.
Yeah. Another one was, how protected are my kids? In this instance, they were 8 and 10, but how protected are my kids wearing masks if the majority of kids aren't masked? And we heard that from several places, okay, I'm sending my kid in the mask, but others
sending them out there.
Right. So what would you say to that? I mean, is still do
there's
it.
Really, and there's an unspoken question, which is, what is the impact of me telling my kid he has to wear a mask when that kid doesn't have to wear a mask?
Exactly.
Or their parents saying they don't have to wear a mask. So the first thing is that the same way that I'm wearing a mask because I'm trying not to transmit it, but I'm also trying to keep myself safe. It's not perfect. So our best chance at keeping everyone safe is having the highest number of people vaccinated that we can have vaccinated. And so that's one of the things, is trying to get our adult numbers are still only a little above 50% in Douglas County. So if we could really get our adult numbers up, that would make it safer for your 8 and 10-year-old. And then I think it will be challenging. It's not perfect if you know that they're sitting in a classroom next to somebody without a mask. But it's better than, again, not having a mask on. It would be ideal. And so that brings up that question of, how do I talk to my kid about why we're wearing masks and other people aren't wearing masks? And it may be, everybody is interpreting the information out there the best that they can. Everybody's parents want their kid to be as safe as they can. And so, Joe's parents have decided that this is the way they're going to. It's sort of like some kids don't have to wear helmets, and we wear helmets in our house. And some kids, they get to get out of their booster seat earlier. Everybody's parents doing their best job as they can. And this is because I love you and I really want you to be safe. We're seeing your grandparents, we're seeing so-and-so. And so we just need to make sure that we're keeping our family safe. But I think one of the things I've taken away in the last year with all of the different events, the pandemic and racial trauma, is that there's plenty of people making judgments, and I don't necessarily want to get into that
I like that
discussion, right? I want to just sort of make sure that I've explained to the people that I care about, this is our reasoning, and we'll make sure that we'll keep ourselves safe. And I really want to believe that everyone's trying to make the best decisions for their family that will fit their family. And we just maybe don't know all of that background information, why it doesn't fit Joe or Sarah to wear their mask.
So another question came in related to kindergarten learning. And, a lot of kindergarten, it's the teachers mouthing to learn sounds and reading. How do you think masks affect learning in that sense, right? When I can't see your face as much.
So these teachers have been so amazing. So these teachers are so creative. And I work at Madonna Rehab Hospital. And so a lot of the teachers that are working with speech and with kids with speech needs have purchased, because they're just angels and they purchase out of their own budget, the clear masks. They're not something you can wear all like the whole day because they steam up and kind of look disgusting. But when when they're working individually with a child that needs speech stuff, they're doing that. So I wouldn't be surprised if your kindergarten teacher has already worked some of that stuff out, or is distancing in the room. So saying, okay, we're going to work on some things. So pulls him or herself back, so that they can say, look at my mouth, and see that. And that's a really important thing. Dr. Montessori, who was a pediatrician centuries ago, really focused on look at my mouth and see my the way my mouth moves. And I think these kids are quite amazing and resilient. I was surprised. The one child that we worked with at our house that has a learning disability, it was her best year. And so it's been a really hard year for everyone, but I think there's been a lot of successes and silver linings.
Adaptation for sure. What are your thoughts on, they're coming in fast. What are your thoughts on masks at recess?
Yeah, so I'm less of a sort of a stickler for masks at recess, because I think we know outside is a safer place for them, and they're moving around fast. And so I think that'd be a great mask break. So if we're going to be in a mask optional kind of a setting, that I would send my child with, when you get outside, feel free to take your mask off, run around, shake and wiggle and get all your wiggles out. I think if recess is inside, that's a little different, and more of a discussion. So as it gets colder and we're doing indoor recess, if you can separate yourself and you guys are coloring and it's a little bit less of a huffing and puffing kind of a thing.
I guess backing up, what is the status of COVID-19 in our community, particularly with kids? I mean, what are we seeing? What is the trend even at children's?
Children's. So, I think if we look over the year, it was different to me than I thought it was going to be. So if you would have asked me last March, I would have thought that we would have seen our medically fragile and our special needs kids as the ones hospitalized with COVID. And I don't know if their parents are exceptional, which they are.
They are.
Or something else playing into it, but that's not who we hospitalized. We hospitalized our teens and our kids who live in bigger family units or are more exposed to essential workers. And so it was healthy kids. So unlike that adult sort of narrative of underlying medical condition that we kept hearing about, that's not who we hospitalized. I did feel like June, we had a dip in the number of cases. We weren't seeing, 1, 2 a week in the hospital, and we had a dip. And I'm going to pull up the numbers because I think that was spoke to by the numbers. So if our positivity in June was wonderful, and we were like at a 1.3 positivity for our tests, so really low for the number of cases actively in the community at the end of June. And this week we're up to 6%, or 6 per 100,000. So about 5 to 6% positivity for our tests. And so if you remember last year, we were talking about what is the positivity that we don't need the mask mandate. And we were setting this sort of arbitrary number of 5%. And if we could get our community positivity down to 5%, and we were hovering at like 20%, 15 to 20%. So we were way higher. Then we got it down. It was a really active vaccine campaign, did a really good job pushing vaccines. The over 60, I don't know what their actual numbers are, but they're like up in that 80 to 90% vaccinated. And so our numbers really went down. And that's, I think, when everyone started to feel more comfortable going out, and we just felt like, oh, taking a little breath. And then now we're seeing that Delta variant just creep in. And I think we're not in Arkansas and Missouri sort of state of emergency, but I don't want us to say like that we have to get there. Like, wouldn't it be great if that was something that unfortunately happened to Missouri, but we were able to respond in a way that got our vaccine rates up, and that we kept our kids safe, and we didn't have to talk about going virtual again. So we're not seeing as many kids right now with COVID, and our community positivity rate is low, but we're at home, we're outside, and we're not in school. And so all of those things are about to change pretty quickly.
How are vaccination rates in that 12 and up range? Obviously, we've made a really strong effort.
We made a really strong effort. And I think it's also hard, the timing, because we're at home, right?
But my question was, how are those looking? The ones that we can vaccinate, and obviously Children's has made an effort to.
Children's is right there. I love that. We've been very active at trying to get our kids safe and vaccinated, and bringing it to all the clinics, and trying to be creative at bringing it to the zoo, and to the kids aftercare programs. So I'm going to pull up. So the kids in the 16 to 19%, or 16 to 19-year-old rate are at 49%, 49.6% fully vaccinated. I mean, so to me, in our state, like I'm kind of proud of that. I'm kind of proud that we're at
high to me.
Yeah, 50% of our teens are vaccinated. I feel really good with that, and a little bit over 55% with at least one dose. When we look at our kids, so we have them clumped as 0 to 15. So that only means that we're really getting the 12 to 15-year-olds. We have about 10% of those kids are vaccinated. So we still have a lot of room for that age. And to me, that was a little bit that we did that big push at the end for vaccinate before you graduate. We had those vaccine clinics at the high schools, which really helped. Because in some ways it's just getting your kid there, right? They don't love shots. They're not going to really jump in the car, let's go get a COVID shot. And so having that easy access.
So there was a question about, kids who are immune compromised, kids who've had transplant and not able to be vaccinated. Obviously, a lot of those in that younger group, should they go to school? I mean, is that just a conversation to have with your specialist, your pediatrician?
I think it is. There are going to be a lot of different variables when you're talking about a child, and it will depend on their developmental age and their developmental needs, because there are some, and their temperament. There are some kids who are more of an introvert, can learn great from a computer, have access to high-speed internet, and a person who feels really good about their curriculum. And there are other kids that their temperament is an extrovert, that their needs require some PT, some different adaptive things. And it's trying to find a way to engage them in school without putting them at risk. So is it doing half of the day and not doing, is it enriching the home environment with some activities? But I do think, again, I'll go back to one of the things we took away from last year is not minimizing the importance of having our kids together interacting in school.
Yeah. What are your thoughts? And I feel like this is kind of a drum we've hit for the last, since March 2020. Someone had asked, what are your thoughts when people say COVID-19 barely hits kids, they're not affected?
So I think we wanted to believe that. So again, when we first were getting data from China, I have the paper, I saved it. They gave us a paper that said of the 800,000 or, of their population, they only had 2,300 cases and only 6 kid deaths. In hindsight, I think that was radically underappreciated, under-tested, and under-reported. So the reality is it's not a zero. And the other struggle that I have when I have a relatively healthy guy is that it doesn't seem to have a predictor. So if you want to say, well, you know, if you're old and you have diabetes and you have a heart condition and you smoked, that's where the COVID is really going to be a problem for you. That isn't, we don't have those like sort of, well, my kid isn't this and this and this, and so they're going to be okay. It is healthy kids without chronic medical conditions. So I can't give you a sort of protective feel that just because your kid is healthy, COVID won't hit them. So they are impacted. The other thing that I think is interesting that we're seeing is, I've seen a little bit, is this, the long-term neuropsychiatric impact of COVID. So for COVID, people who've had COVID with COVID survivors, it's clearly a neurologically active virus and it's causing inflammation. And we're seeing what we call in adults the long haulers that have chronic daily headaches, chronic fatigue, concentration, and the numbers for psychiatric conditions are overwhelming for those survivors. And so that piece of suicidality, depression, anxiety that it has triggered in survivors. So I don't want to minimize the impact long-term for adolescents and young kids.
So we have talked about the recommendation from the American Academy of Pediatrics about 2 and up wearing masks in school settings, but one piece of their recommendation was that even if a 12 plus student goes into the school, they're vaccinated, a vaccinated 12 and up student, that they should continue to wear masks. And that was different from guidance from the CDC. And that's kind of tripped people up. They're like, you know what? You're saying this.
Wait a minute. I got the shot. The shot's supposed to liberate me from
right. And and then this is what Children's is saying. This is what I'm hearing from my school. This is what I'm hearing from my neighbor. But really, with that AAP CDC, one question from Blair on Instagram was, "What source should you base your decision off of?"
Right.
So many sources.
Well, I love, Blair, that you're asking what source, because there is a lot of information out there. And the hard piece, even for me as a scientist, is to say, is this trustworthy? Is this good information? Because some of our sources, we just want to make sure that they have, that it's science they're reporting. And move around, Sarah.
I know we have these green lights that turn off when you're not moving. Sorry about that.
That's okay, that we have all this conflicting information. So what I would say about why it conflicts is that the reasoning behind wearing the mask would be that we feel like when you have a vaccine and you get the infection, you're shedding less. So you're less contagious, but we didn't say zero contagious, right? We said less contagious. So if you're vaccinated and you're in close environment for the 8 hours of the school day with other people who aren't vaccinated. So I think it really speaks to the percentage of vaccinated people in that school. So if you knew, for example, that your school was at like a 70% vaccination rate and that 100% of the teachers were vaccinated, you would feel better about sending your vaccinated 12-year-old to school because the 100% of the teachers are vaccinated and 70% of the students are vaccinated. And so everybody's in a pretty good situation. But what this AAP is saying is we're probably going in with 10% of the students being vaccinated and 50% of the teachers being vaccinated. And so the risk for your child is still not ideal. And so the CDC, again, is saying we feel good that when you're vaccinated, we haven't seen a significant number of vaccinated people pass away. So that mortality risk is really almost eliminated. And that hospitalization rate, when you look at hospitalizations, we're in the upper 90s that it's all unvaccinated. So when we look at the people that are currently in hospitals with COVID, it's in the 90s that those are unvaccinated people. And so this is the second part of the pandemic, is the pandemic of the unvaccinated. But that still impacts us as the vaccinated because you can still get some of the symptoms. And then we have these vaccinated immune incompetent people who have a partial response, who are still going to be at risk.
One question from Whitney on Instagram was, will children be advocating that schools mask this fall? And if so, how?
So I think we're always going to advocate that our kids are safe. So I'm going to advocate for helmets. I'm going to advocate for seatbelts, and I'm going to advocate for you to keep your kids safe with a mask on. I am not going to, you know, shame people into making their own, into making a different decision, because we have to have all the information. But I hope that we can be, for Blair, a reasonable resource of this is what we have out there right now. So currently, with our vaccination rate and our community rate, we would say put a mask on in school, but feel good that your kid can run at recess, and that will continue on our COVID resource board on the internet to update that information and give real-time information. Oh no, we're having more of an outbreak. We're admitting more kids. We're going to now tell you to mask outside. So I would say, yes, we're advocating for kids to wear masks in school, but we want to advocate for them to be in school. And so that's why we're advocating for them to wear masks.
I feel like there's been such an amazing collaboration between
the
health community and the school community, like just locking arms in constant community. So that bodes well for the safety of everybody. Children's is part, of course, you know, why are we in this limbo? Why are we having this conversation? Because there's not a vaccine for children under 12 right now. So I want to pick up on that piece. You know, children's is part of the Pfizer research trial right now, studying vaccine safety in children younger than 12. So can you give us any update on how that's going? And she's like, no.
I didn't go get that information. I should have got that information.
Well, maybe you'll know this. When do you predict we'll have a safe and effective vaccine to roll out to children? You'd mentioned earlier, like later in the year.
Yeah, so you know, I'm excited. We did enroll. We filled our study arm, and so I think I'm so grateful for the people who participate in studies. To me, they have to then have about 6 months. So if we started in June, you know, then we're looking at mid-fall, and then they have to look at the data safety and say, did we see any significant adverse effects? And when we say significant, it doesn't mean that people didn't have any adverse effects. We're looking at a predictable number. So what I also love when you talk about collaboration is the transparency of this research. So, you know, I'm a Black woman. There's a lot of talk about like corruption and unethical research historically in the US, and people bring up Tuskegee. And so I sit on the IRB board because I feel really passionate that we can't move science without ethical research, but ethical research comes with openness. Yes, we have had this side effect. This is what we're doing. We stopped the study. We're continuing the study. And so I have loved watching us see people with concerns and those being shared publicly, investigated, and then a public answer. And so to me, that is how it's supposed to work. We're supposed to say, okay, we've seen 6 cases of this. What do you think? Is it related? Is it not related? Who does it impact? How do we discuss that possibility? And so I really enjoyed that. So I think it will probably be around Christmas break. So I would love for it to be Thanksgiving break, but I think it will probably be Christmas break that will really get the science. The data will come back and say, we can go.
Okay. You mentioned, you know, common concerns and just getting them out there. And one concern that we've heard several times, but for this Q&A especially, you know, I think it was like a twin 13-year-olds, this mom, and she's like, but I'm concerned about long-term side effects. What do we know about long-term side effects?
So I'll start with that. Vaccine safety. So we've been vaccinating since polio, so since the 50s. So when we look at what do we know about asking your immune system to make protein to remember an infection, we have known that for half a century and have some pretty strong information that it's good, it lasts, it's doesn't have long-term effects. The big concerns came out on how we made this protein, so the mRNA. And does that mRNA stay around in your body? And the answer is no. It's not in your body after about 48 hours. So we're not putting in a piece of mRNA that can change your body's genetic code. makes that spike protein and goes in. So then the question comes, well, is there a long-term immune response reaction? Well, yes, we hope so. We hope that your body makes spike protein that remembers COVID and kills COVID, but we think it probably won't. And that's the other piece, is that we think that it probably is going to forget how to do this, and we're going to have to do a booster. But we don't expect that there are long-term complications from the vaccine, from any of the other sucrose components and things that are in it to deliver the protein. So the answer is not any different than the DTaP vaccine that you get when you get cut and go into the ED for tetanus prevention, or the Hib vaccine that we came up with in the 80s to prevent meningitis. I think you're weighing the risks, and I agree that this is a weight on a parent's thing. I don't want to choose for you some kind of long-term chronic disease, but we don't have a zero. So we have long-term effects of COVID as a real possibility, and possible long-term effects of a vaccine. And so it's not zero. It does bode in the favor of the vaccine over the long-term impact of the COVID, especially after we have a year of data that people are really still struggling with COVID after recovering. So I agree that it is something you have to think about, but I don't want them to go in thinking that there are zero risks of long-term impact of COVID, because there are real risks of long-term impact of COVID for kids.
What we had another question about what's the benefit of my child wearing a mask if others aren't. We kind of talked about that.
It's hard.
That all you can do is what you can do was kind of, I think, the take.
Well, and it's hard because it feels like you're sort of being punished for being the good behaved one. Like,
you're no fun.
You're no fun. I am talking to my son about, there's some important things that he has planned for fall as his senior year, and trying to preserve those. So sort of looking at, and in my life, I'm always looking at, like, what is the gain? What is the carrot for me? So for him, he wants his football season. And so how do we retain that sports season? Well, if you get COVID, there's a lot of restrictions after you have COVID about when you can return to big exercise. And it's like 90 days, and that's a season. And so if he really wants his football season, then we really have to not only avoid like the team getting canceled, but he has to himself avoid getting COVID. And so to him, that's an easy no-brainer. I'll wear the mask. I think what I've realized is kids will wear the mask. It's us adults that are really struggling with the mask. But kids will wear the mask, and they kind of, they'll fuss, but then they go about it and continue.
I think that's actually a really good pivot and kind of conclusion, is I think it's adults that okay, so these recommendations came out yesterday. I think it was adults that were come again on your news feed. You're like, what? Because it's exactly, it feels like, again, it's just another reminder that this isn't over, which it isn't, but it's still hard. And so I guess, what would you say to parents? I don't know if it's a pep talk, but to hold on. I mean, you started saying, we've come from a mighty long way. But what would you say to parents who are like, gear back up here and let's, I don't know if it's finish strong. I don't know if that's the message.
Right. But, well, sort of like the dig deep, you're like, it's the fourth quarter,
dig deep.
And we're going to have to dig deep, and we're kind of tired, and we're going to have to, give ourselves a little bit of a pep talk. But I think we can look at other history. So, we can look at the influenza pandemic of 1917, 18. It was a 2-year issue. It wasn't a 1-year issue. And people have journaled and written some really interesting things that I think that are still timeless when they talk about, people traveling and sort of some snarkiness of, I can't believe so-and-so. I was reading some journal, but I think it's not a forever thing. We are getting better with the science. We are making progress. And so that idea that it's never ending, that's hard to live with, right? That's really hard to imagine. but I like to think of, I'm doing this so my kids can stay in school. I'm asking them to wear the mask so school stays open. I'm making sure that they're masked so there isn't a teacher shortage. Because the other thing that I'm really worried about is, if the kids are still healthy, but what about we don't have enough teachers? And all of a sudden now we have to go remote because we have to put them all in one classroom. And so how do we keep all those adults? And so finding what are you going to treat yourself with? So, what are those activities that are still safe and fun that we can refuel ourselves a little bit at the end of the week? Like, okay, we made it through this week and we have fire pit now. We've all done a lot of great yard work and invested in our outdoor spaces, hopefully, and give ourselves a little bit of grace to refuel. But you're right. It is hard to imagine, like, we're still talking about masks. We're still doing it.
Yeah, you get it. I like that you're like,
yeah, I get it. I get it.
Easier, but like you said, dig deep, do the right thing. We're hanging in. Thank you so much. I mean, it is funny to think we've been having these talks for a long time now, but it's getting better. And I just really appreciate you. I know everyone watching appreciates you sharing your time and expertise. And
we want to be there. We want to do this together. I think it helps me when I sit down with other moms and I hear that I'm not the only one who is just really done trying to figure out what we're going to have for lunch.
Parental burnout. I like that term.
Yes.
That's a new one.
And so it just, I think that remembering we're here for each other, that we are open for questions. We're not mad at your questions. We're all thinking very similar things. And hopefully if we didn't answer it, you can get on your Children's Connect and ask your office those directed questions and get some help. I had heard rumors from Dr. Logan that they're going to try to have vaccine available at back to school nights. And so I haven't heard the specifics, but I hear rumblings again, because we're all trying to work together. So I would hope, and then hopefully we'll partner with them and be there to answer questions at your back to school night. Maybe more to come from us.
More to come. I'm sure there's more to come, but that's a great end. Talk to your pediatrician, reach out. They want to help. So thank you, Dr. Stuhlman. Thank you everyone for watching. You can always get more information at children'somaha.org/COVID. And thank you and take care, everybody.
Thank you. Good luck.